one on my list is the University of Texas, UT Southwestern. So do we have the UT Southwestern team on board?
Hi everyone, I'm Kim Barker. I'm the Residency Program Director. With me tonight I have Dr. Reed Williams, who's my Associate Program Director. I have both Chief Residents, Brent Page and Lauren Fulks. I have some of the current residents, Kayla Williams and Mona, I believe, is on, and then Donald Kasitanon is a recent grad, so we'll all kind of take turns, but I'll start with the PowerPoint. Oops. Here we go.
We can see your screen. Go ahead.
All right. Where's the... All right. So, UT Southwestern. First of all, we are in Dallas. I know you can't tell by the name, but we are in Dallas. And as you know, Dallas-Fort Worth is one of the largest metroplexes in the US. There's about almost 7.5 million people. It's also one of the fastest growing metroplexes in the US with Toyota, State Farm, and a lot of other companies moving to the area. Most of our residents and faculty live in Dallas, but quite a few of the faculty will also live in the suburbs. And a couple faculty and one resident right now live in Fort Worth and commute over from Fort Worth using the train. There's lots to do. There's lots of outdoors activities. There's quite a few lakes. If you are interested in kayaking or rowing, some of the lakes are actually large enough to sail if you like sailing. I know that's kind of weird to think about in Dallas, but it is true. The training, so UT Southwestern, you would be training at both the medical center at UT Southwestern and then a lot at Parkland Hospital, which is the county hospital in Dallas. It is going to be the nicest county hospital you'll probably ever see. It was built in, it just opened in 2016. It's 860 beds. It's 200 ER beds alone. It's a wonderful training experience that reaches out to our underinsured and uninsured residents of Dallas. This is UT Southwestern. This is Clements University Hospital. You'll also be rotating at Children's and then the VA and then Presbyterian, Texas Health Resources Presbyterian Hospitals, the county hospital, the community hospital that you guys will be rotating at if you come here. An overview of the department. The department actually started over 50 years ago. It is the only department in the US of any specialty to have 3 women chairs in a row. So Dr. Fela Helm, Dr. Karen Kowalski, and then currently Dr. Kathy Bell. We have 40+ faculty ranging from the normal things like TBI, pain, sports, stroke, but we also have more unique subspecialties that are covered here at UT Southwestern. There's cancer rehab, pelvic floor, burns. Kind of to go back to Parkland, a couple of the things that Parkland's most famous for is the burn. So if you remember learning about the Parkland burn formula in med school, that's where the Parkland burn formula comes from. The other famous thing from Parkland is that's where JFK passed away. That's not really the highlight of Parkland, but one of the other famous things. We have a newly renovated research lab space that just opened up. We have a ton of clinical areas in the suburbs. We're part of the model system for brain injury and burns. We are actually in the top 20. I think we'll probably be in the top 15 in regards to research money for PM&R departments in the nation. To talk about the residency program, because that's what you guys care about, right? The residency started in '77 and it's been ACGME accredited since '78. It's one of the larger PM&R programs in the nation. We have 6 interns and 9 residents, so we have a total of 33 residents. It's a nice broad curriculum. It covers all of the required ACGME requirements, so 12 months of inpatient, outpatient, EMGs, ultrasound, all the spine procedures. It's a very friendly learning environment with a varied patient population. Again, referencing Parkland, we do see a lot of the underserved and underinsured patients. You see a lot of unique diagnoses over at Parkland. There's a leprosy clinic there. I've seen scurvy there at Parkland, so you get to see a lot of interesting pathology. It's also one of the more hands-on residency programs. You get to do a lot of peripheral joint injections, spine injections, a ton of EMGs. We also have a global health experience every summer, except for this summer because of COVID, where we go with one of the neurologists over to Ethiopia and teach about neurorehab. Our residents are very close-knit. This is a picture of one of the wellness events. So we have a wellness committee within the residency and fellowship, and then also a wellness committee amongst the faculty. But the residency and fellowship wellness committee is actually based on the 7 tenets of wellness. So not just socialization, but exercise, spirituality, education, volunteerism, all of those things are covered with the wellness committee. Pictures, because I think most people are looking for a nice, friendly residency program, and pictures are the hard proof that I can show you that we are friendly and we all get together. So these are some pictures of the faculty. Up here on the top left is some of the PM&R members that went for lobbying up in Congress. We have Dr. Afechka, who's one of our stroke rehab doctors, and then Dr. Sin, who's one of the peds rehab doctors. Dr. Kowalski is here representing the AAP, also lobbying Congress. Here was one of the faculty intrathecal pump refresher courses. We were using one of the faculty members' teddy bear, Pumpo Bear, to remember how to interrogate and refill Pumpo Bear's baclofen pump. This is a picture from Puerto Rico a couple years ago for AAP. Almost everybody in this picture, except for Avi and Ben Shahabi, are all the faculty that went there. And this is our holiday party from last year in the ugly sweater competition. Here's some pictures of the residents doing, unfortunately, or fortunately or unfortunately, non-clinical things. So there's a football event. This is a picture of the senior class. This is one of our other wellness events where they planted their own little terrariums. We've had a lot of wellness challenges since COVID started. So some of the consult residents were doing various handstands and other push-up challenges. And these are just pictures of lecture and our education retreat. So here's the information. So the chiefs are Lauren Folks, she's our academic chief. Brent Page is our administrative chief. Terry Isbell, who's not on right now, is our program coordinator, and she is fabulous. Once you meet her, you'll never forget her. If you have any questions, feel free to go to our website. And if you have any questions about applying, you apply on ARIS. I'm going to hand it over to Brent.
Thanks, Dr. Barker. Hey, everyone. Thanks for being here and hearing a little bit about our program tonight. So I'm one of the PGY4s, and like Dr. Barker said, I'm the administrative chief resident here in Dallas at UT Southwestern. We have a good array of current and former residents on tonight. So if you have any questions as we're talking, please feel free to put them in the chat and one of us can answer for you for sure. I guess what I would say, one of the highlights of the program for me is the diversity of the clinical sites and the diversity of the patients. So like Dr. Barker was saying, really the majority, I would say, of our time as residents are split between 2 different sites. Of course, we rotate at the VA and a freestanding children's hospital and a number of other sites. But the majority of our time is spent between the UT side, the University Hospital side, and Parkland, which is the county hospital. UT side, we really rotate between 2 different hospitals there. One of them is currently undergoing an expansion, and in total we'll have nearly 1,000 beds actually when the expansion is completed here later this year, I believe. And then Parkland, of course, is one of the busiest county hospitals in the United States. There's nearly 1 million, actually there's over 1 million total patient visits a year, nearly 50,000 inpatient admissions a year. So we get a broad exposure to polytrauma, being a level 1 trauma center, TBI, stroke, you name it. And one of the great aspects is both of the buildings are literally right across the street from each other. You don't even have to walk outside. There's a sky bridge that connects the 2. So you have all that resource kind of right there, right where you are every day. So I'll turn it over to Lauren Folks, who's the academic chief resident, my co-resident. Lauren?
Perfect. Thanks, Brent. Hey guys, I'm Lauren. So I'm academic chief, like Brent and Dr. Barker both said. So I think one of the main reasons why I chose and ranked UT Southwestern super high on my list was that I liked the bigger program, and I wanted to make sure when I was coming into residency that I was getting a good sense of community. And definitely, I'm from Ohio originally, so coming into Dallas and having this large network of not only co-residents, but faculty and staff that regularly get together and hang out and genuinely like each other was definitely a big positive of this program. So I think that was definitely one of the main reasons why I kind of chose to come down to here. And just don't take Brent and I's words for it. We will have some of our other residents kind of answering some questions. So first up, we're gonna have Mona, who came in as a new PGY2. She's been one of our PGY2. She came as an intern, but she's been on the wards for how many days now? Like 2 whole weeks, right? So our question for you is gonna be, why did you kind of choose to rank this program?
So I ranked this program because of a couple of things. First thing would be it's truly a resident-run program, so they're on the forefront of care. It's also amazing that they have this categorical year that is balanced, so it makes for a nice, easy transition into PM&R as a second year. Also, I'm from Texas. I've lived here all my life. Rarely any snow, so no fuss. So that's a plus. Huge low cost of living and lots of space. And last but not least, Terry. Terry Isabel is our program coordinator. The moment I met her on interview day, I tell you not, I kid you not, she was the most infectious, most humorous, most warm personality. And I knew she was someone that wanted to be there to support the residents, to be our biggest advocates. And having been in this program for a little over a year now, I can say she's everything I thought and more. So those would be my reasons.
Perfect. Thanks. And then Kayla, who's one of Britt and I's co-residents as well, she's also a PGY4. So what kind of has been your favorite part of residency, since we are, as shocking as it is, 2 weeks into our last year of residency?
Yeah, so I'm Kayla, PGY4. I'll kind of have to echo the last comments. Is Terry was a big Terry has been a big asset to the program. Like Lauren, I'm not from Texas, I'm from Virginia actually. So having that extra layer of like support is huge, knowing that, you know, I didn't come to Texas with family or a whole lot of friends that were even here. So just knowing that you have that support was huge. The other thing that I've really enjoyed about this program, aside from just the breadth of exposure that you get, is something I didn't necessarily realize coming in, was just like the quality of the attendings and their commitment to our learning and their mentorship and support through this whole process has been like invaluable. And just there's experts within the field that we have here at UT that you literally learn from, who are the ones that you read out of the textbook, like they're the ones who wrote the chapters. So that's been pretty cool. And that's been something that I've really found to be an asset of this program as well.
Okay, thanks so much, Kayla. And then to kind of finish up our scheduled program for the evening, we have one of our most recent graduates, Donald, who just graduated with us at the end of June, getting ready to actually head out to Stanford for his sports fellowship coming up. So kind of when you think back about residency, what was your favorite part of the program? And if you had to do residency all over again, where would UT Southwestern kind of rank on your list?
Donald, you're on mute.
It's a rookie mistake, but there you go. So, you know, I really thought, and my answer is kind of like a cheat answer because it kind of encompasses a lot of things. But my favorite part of the program was just the focus of the program on constantly getting better. Because within that, you know, as Dr. Barker is talking about, we're in a large hospital system. There's a lot of like good clinical volume, multiple specialties you can work with, and there's plenty of research opportunities. On top of that, this really just trickles down like leadership. It goes from, you know, from like the head of University of UT Southwestern goes to our chair, Dr. Bell, and then like Dr. Barker, our residency leadership, and then it gets down to the residents. We all really are trying to get as good clinically as we can, and then also trying to do some innovation within the field. So that's what I really enjoyed. I would say I would rank the program very highly again, because I really got everything I needed out of my training. And I got to basically do it in like an academic bubble that really supported my training. And I really enjoyed the 4 years, like inside and outside of residency. So the years went by really fast, which is what I think is really important when you make your decision on ranking residencies.
Okay, well, I think we'll open it up for questions from anyone in the audience. If you guys have anything, I know we also have, I think Dr. Reed Williams is here, our Associate Program Director. But if you guys have any questions for us, for Dr. Barker, we're here to kind of answer anything that you have.
Thanks, guys. This is Vinnie. I just want to let you know you have about 5 minutes left. Excellent job.
Perfect. Yeah, thanks, Vinnie and PM&R Scholars for kind of arranging all these things to help us in this new virtual residency kind of interview season.
And shameless plug, we have our emails in here as well as our social media sites. We're on both Facebook and Instagram, so you can also have a lot more information from those places.
I see a question about the call schedules. I can talk about that since I just made the call schedule for the year for everyone. So one of the benefits of a larger program is the call is split up among the large number of residents. So PGY 2s and 3s take weekend call. It's in-house, 24-hour call. So 2 or 3 will take a Saturday and a 2 or 3 will take a Sunday call. Typically, the average is around 6 calls per year. And then, so basically you have 6 calls as a PGY2 and then another 6 as a PGY3, and then PGY4s don't take any call. Holiday calls are distributed amongst the PGY2s.
And otherwise, we have a night float system to cover Monday through Friday.
Right.
Yeah, and then there's a little bit of home call out at the VA that you do when you're out there, but otherwise that's only 2s and 3s. I think there was a question about the formal mentoring program that we have. So when you come in your PGY2 year, we do give you an assigned kind of faculty mentor to help you get started. It's definitely not to say that you can't pick up faculty mentors along your journey throughout residency, which I've picked up several besides the one that was assigned to me. So we do have a plan in place to have some kind of attending experience. Sorry, my cat's going crazy. Give you some experience with an attending up front.
We also have a mentorship program within the residency itself that Stephanie Tao started when she was a resident, and she's coming back after doing her PEDS and sports fellowship. So an intern, a PGY2, a PGY3, and a PGY4 are all signed into a house. It's like a Harry Potter house. And within those groups, they can meet as often as they want or as little as they want, but it kind of helps give you some guidance, somebody that you can ask like, hey, what can I expect from next year if you just started the program as a new intern or as an advanced PGY2.
All right, guys, you have about 2 minutes and 30 seconds left. We'll give it a few more minutes here or see if we have any additional questions.
Perfect. Donald, do you want to answer in the chat the question about sideline opportunity coverage? And then I know Kayla addressed the pediatric exposure.
Yeah. Also, I see that question from Suma about Parkland Hospital.
Yeah, that as well.
Okay. I can first talk about the sideline coverage then. I guess I did a lot of sideline coverage within residency. I'm kind of wondering, you put sideline/arts, Karina, so I was wondering if you meant like performance arts. You can type in the chat box. But for sideline coverage itself, a lot of the orthopedic sports docs, they cover all the Irving high schools, which is a local suburb around here. They cover the whole district. So they're more than happy for you to cover the teams with like all the football teams, the basketball teams. On top of that, I did a lot of UT Dallas coverage, which once you get the phone numbers for the athletic trainers there, they let you do kind of whatever you want in terms of whatever sports coverage you want. And then I see the dance ortho coverage. I actually did do some dance coverage within residency as well. There's some big events that come to the DFW Metroplex. One of them is like this big dance competition, and I covered those events. So essentially, being in a good Metroplex where sports really thrives, the opportunities are pretty much limitless as long as you want to seek them out.
Okay, and then I think I think Kayla addressed the Parkland question. The other one that we saw was kind of cost of living in Dallas. I think, you know, the cost of living in Dallas is definitely unaffordable for a bigger city. I mean, I think our salaries, I don't think any of us are kind of scraping by, but a lot of us live close to the hospital and in more of a downtown kind of, you know, younger neighborhoods, and everyone does pretty okay. If any of the other residents want to talk about that.
Your guys' salary is actually very competitive considering the cost of living of Dallas. It's
I will
higher than some of the residents in Chicago or New York or the Bay Area, where cost of living is way higher.
DC, cost of living has been huge. It's making me not want to move to Texas because it's really nice. So take that in consideration, not just for you two, but just in general. The number stretches different depending on the city you're in.
All right, guys. Thanks so much, UT Southwestern, for your presentation. Unfortunately, time is over. We had 20 minutes. Again, I appreciate everyone joining us tonight.